Hello, my name is Scott Spoonholtz, Student Financial Aid Director at the University of Kansas Medical Center. We appreciate the fact that you are considering us for your MD career, and I would like to spend some time talking with you about the affordability of the medical school and debt management here at KU Med. Some topics I'll cover today. How much does the program cost? The aid that's available to cover those costs, the different types of special circumstances that we'll consider, and steps that you can take now to get you ready for the MD program. So how much does this MD program cost? For a Kansas resident, tuition is a little more than $41,000 per year during the 24-25 school year. And for out-of-state students, it's a hair under $73,000 per year. Additionally, there are campus fees of $850 per year for Kansas City or Salina students, and a little less, $700 per year for Wichita students. The Wichita campus does not have a recreation center, so you're not charged for that, and you could obtain a membership at a local gym. Costs also include about $1,200 per year for books and supplies, and we estimate about $418 per year for loan origination fees. And then the last expense are for living expenses, things like rent, utilities, food, car maintenance, cell phone bills. We conducted a survey in December of 2023 and found our students are spending on average about $2,785 per month. And so you would receive that amount for the months that you're enrolled in classes. In years 1 and 2, students are in class 10 months out of the year. So if you are not going to take an elective over the summer, you would not get living expenses for those periods. If you needed to spread out your 10-month aid over a 12-month period, I'd try to live off of more like $2,500 per month so that you have enough for those months you're not in school. But during the last 2 years of the program, students are enrolled year-round, so they get living expenses for all 12 months. How does our tuition compare with some peers? So for the current year, 24-25, it's about $42,000 for the tuition and campus fee. The most up-to-date information I have for public schools is from the 23-24 year. So their tuition's here less expensive, but I would imagine once the 24-25 data comes out that we will be at or below that. For non-residents, again, it's around $73,000 for tuition and the campus fee. If you compare that with other private schools, it's a hair under 70,000. But again, the private schools are sharing 23-24 data, so that gap may narrow once that data is available. And if you're comparing the cost of attendance, so tuition, living expenses, books, supplies, Kansas residents were right with our public school median. Non-residents compared to private schools are a little higher. Again, the public school median and the private school median are a year out of date. So by the time you're listening to this, maybe in October, November, the nationwide data should be updated and you could compare that with our information. If you're trying to look at the entire program year by year, second year students, we're estimating about 72,000 for residents, 104,000 for non-residents. And the difference is second years start studying for and registering for step 1. The costs increase in the third year, and that's because students start studying for and registering for step 2, and then they have 12 months of living expenses as opposed to 10 months. And then the program's the most expensive in the last year, because students are applying for residency programs. They may be driving or flying around the country to interview at those residency locations. And again, they have 12 months of living expenses during that year. So if you're looking at all the costs for all 4 years, tuition, books, residency, step related expenses, it's a hair over 300,000 for Kansas residents, close to 430,000 for non-residents. Based on this year's data, compare that with our public school median and private school, and those public and private schools are based on 23-24 data. So based on that information, let's talk about the aid that can help you pay for those costs. So the first thing you want to do is to file the FAFSA, the free application for federal student aid. And in the past, the FAFSA looked at the student income and assets, and if you're married, your spouse's income and assets. New in 24-25 is that both the student and the spouse need to provide consent to transfer that information from the IRS. So that is one new thing that may not have occurred in the past. And then the other thing is that in the past, the student income and assets, spouse income and assets created what's called the expected family contribution. That has been replaced with what is called the student aid index. And so that student aid index tries to approximate what the student income and asset would equate to per year. And we subtract that from the cost of attendance. Cost of attendance, again, is tuition, living expenses, and other things that are needed for that year. So let's say that cost of attendance is 70,000. Let's say the student aid index from the FAFSA is 5,000. 70,000 minus 5,000 means 65,000 of financial need. So maybe need-based scholarships would be a possibility. Even if this is a 70,000 cost of attendance, and let's say the student aid index is 100,000. 70,000 minus 100,000 is negative 30,000. So that student would not have financial need, but they could still get non-need based types of aid like loans. So regardless of whether you have need or not, students can often receive up to the cost of attendance. The student aid index will determine kind of the quality of that aid. Is that scholarships or something that might be more attractive than, say, loans? So let's talk about loans. School of Medicine has an application that they will share with students when they are admitted, and encourage students to apply for those scholarships and see if those are offered. There are also private scholarships that are available, and federal work study is another program that we can offer. I would encourage students to at least wait until they've attended one semester to determine if they want to do work study. The MD program is very intensive, and we want to make sure that you're getting good grades, you're developing good study habits before you start to add a job to your out of class time. Something I would like to spend some time in particular talking about is the Kansas Medical Student Loan Program. The legislature has provided money for 3 different programs. The primary care are for students interested in any of these 4 fields: family med, internal med, pediatrics, or emergency med. So you don't have to know which one of those 4 that you want to practice in, as long as it is one of those 4. There is a separate program for students interested in either psychiatry or child psychiatry. And then the third program, which is the newest, is for students interested in obstetrics and gynecology. These programs have the following things in common. They will pay 100% of your tuition, and they'll provide anywhere from $18,000 to $22,000 per year in living stipends. The only things the program does not cover are campus fees. In some years, it does not cover all of living expenses. This year, it is $785 short of what we estimate for that. Does not cover books and supplies, step exams, residency related expenses. So it covers all but maybe 12,000 per year to 18,000 per year. And if students want money for those other expenses, they can certainly borrow something like an unsubsidized loan, a KU endowment, or private loan for those expenses. Students then have to match in the correct field for their residency. So again, for example, primary care, a student would need to match in internal medicine. And they can practice or they can do their residency in internal medicine anywhere across the country. So it could be in Kansas, but it could be in Oregon or Florida. And then when their residency is done, within 9 months, they agree to return to Kansas and serve in high need areas of the state. Generally speaking, 1 year of service in the high need area forgives one KMSL contract. Any county is allowable except for Douglas, Johnson, Sedgwick, or Shawnee. So those surround kind of the largest metro areas of Kansas City, Lawrence, Topeka, and Wichita. If someone does not want to serve in those counties, they could serve at a VA hospital in Kansas. They could serve at a community mental health center, or they could serve at a clinic that exists for low-income patients. An example I like to give is Grace Med. They have locations in Wichita, which is in Sedgwick, and Topeka, which is in Shawnee counties. Normally, those would not be allowable for KMSL, but because Grace Med exists for low-income patients, you can do a year of service and get a year of forgiveness from KMSL. You can teach full-time in Kansas City or Salina, 1 year of service, 1 year of forgiveness. If you teach in Wichita, that is the one exception. The statute says you have to do 2 years of full-time teaching to forgive each KMSL contract for that. The way that we prioritize recipients is we look at 3 areas: where you're born, where you graduate high school, and where you're living when you enter the MD program. The highest points are awarded to students who come from underserved areas of Kansas for each of those 3 areas. Middle of the road points for Kansas residents, but from kind of bigger counties. And then the lowest points are for non-resident students. The statute allows us to award non-resident students, but we have to consider all of the Kansas applicants first before we consider non-resident students. There are varying levels of support for the program. So the primary care program has been around the longest. We have enough money to award anywhere from 100 to sometimes 120 students per year. We save 30 contracts for incoming students. And in some cases, we don't have 30 students who are interested as incoming students. In some years, maybe we have 35 or 40 students who apply. And so in that case, we may not be able to award all of the applicants. Because students can change their mind, in some cases, they give money back. Maybe they sign up for primary care, but determine they want to be a surgeon. Maybe they have an idea they want to serve in rural Kansas, but they meet someone who's living in Chicago and they're going to go live in Chicago after graduation. So they may give a contract back. So in that case, we have a retroactive process. And we try to prioritize 4th-year students at that point. Let's say we had 20 contracts and 5 4th-year students. In that case, each of those students could have their 4th-year loans canceled, and then we could give you the equivalent of what they would have received as a 3rd-year student, 2nd-year, and 1st-year student in that retroactive process. We would help you repay some of your previous loans. so that we would minimize what you owe the federal government or a private lender and provide you mainly forgivable Kansas medical student loans. So that is how the retroactive process is how we handle all of the psych and the OB-GYN, just to try to maximize how many students we can award from those programs. And then for primary care, again, we save 30 spots initially, but we have a retroactive process, and the number of retro contracts for primary care can vary from year to year. So as long as you are sure you want to serve in high need areas of the state, it's a great program. I encourage incoming students to apply both for a scholarship and for KMSL. If you are offered both, you have to make a choice. You can either get a scholarship and not KMSL, or you can get KMSL but not a scholarship. We want to make sure that we can kind of spread our funds to as many students as possible. So that's why you can't have both a scholarship and KMSL. But let's talk about what happens if you do not fulfill KMSL through service. It is a loan. It's at 15% interest. That interest goes back to the day that you received the loan. And so what that in essence does, the amount that you received doubles in under 5 years. So it could double by the time you're in residency. It could double again early into your attending years. So it's something not to take lightly. I encourage people to apply for it, but if it's offered, at that point you have to make a decision. Am I really sure this is what I want to do? Or do I want to say no now and then try to get it later as a second, third, or fourth year through the retroactive process? If you're interested in service programs, just not in Kansas, there is the National Health Service Corps. It works similar to KMSL, it's just on a nationwide scale, high need areas throughout the country. The military has scholarships and Indian Health. Essentially, all of those programs will pay for tuition and give you living stipends and generally want you to serve 1 year for each contract that you receive. If those programs are not of interest, let's talk about kind of the typical types of loans students may receive. The government provides unsubsidized or Grad Plus loans. We have a need-based primary care loan, but it's only for students in their third or fourth year. And then KU Endowment or other private lenders also provide opportunities for students. Unsubsidized loans are around $42,000 for the first year. There's no credit check. The Grad Plus then could fill any remaining gap you have. So if the cost of attendance is $71,000, the Grad Plus could fill in that other $29,000. And then KU Endowment or private loans could be options if you prefer those to some of the other options or in combination with other loans. The unsubsidized loans are $42,000 each year as first and second year students because you're in school 10 months out of the year. Once you're in school year round, that amount in the last 2 years is $47,000 each year. The interest rates are fixed, but it's based on the time when you borrow those. So students this year are receiving basically an 8% interest rate on those unsubsidized loans. And that's as high as it's been maybe in the past 15, 20 years, something like that. Those loans also have an origination fee. The government deducts $10 out of every $1,000 that you borrow before they send the money to KU Med. As a first-time borrower, you would need to complete what's called a master promissory note. Grad Plus has a 1% higher interest rate. That origination fee is $42 out of every $1,000 that you borrow. It has a credit check, but it's only looking at red flags, things like bankruptcy in the last 5 years, being 90 days past due on a balance in maybe the $2,000, $2,500 range, something like that. If that does not apply to you, then you should be approved for that loan. And Grad Plus has a different promissory note. And if you are a first-time borrower, you need to do loan entrance counseling. There's a kind that is for grad and professional students. If you complete that, that will cover both unsubsidized loans and Grad Plus loans. So this is kind of how things work in practice. First year Kansas resident, they can receive up to roughly $71,000 per year. So we will package this $42,000 unsubsidized loan first, and then we leave it up to you what you want to do in order to get the other $28,000, whether you want to do Grad Plus, whether you want a private loan, or KU Endowment Association loan. For non-resident students, all of the expenses are the same except for tuition. So the cost of attendance is higher at $103,000. Again, we'll package that unsubsidized loan and leave it up to you for that other $60,000, whether you want Grad Plus, private loans, KU Endowment to get you to the $103,000 total if you need that much. On the topic of KU Endowment Association, they give you up to $6,000 a year, up to $24,000 over your career. So it's not a huge program, but especially right now, this 5% interest rate is quite a bit lower than the federal loans, and it has a 2% origination fee. The kind of biggest downside to the endowment KU Endowment Association loan is that it does not qualify for public service loan forgiveness. So if you're thinking about working at a federal, state, local employer, making payments for 10 years and then having the rest of your loan forgiven, endowment loans do not qualify. Private loans do not qualify. Only federal loans like the unsubsidized or Grad Plus qualify for that program. We have maybe 70 or 80 students a year across all of our programs who borrow private loans. They're very much based on your credit score. And so those who have excellent credit maybe will qualify for an interest rate lower than the 8% unsubsidized. And if you get a low interest rate, you're not interested in public service, this might be a good option for you. You would apply with the lender. And then there's an online form that you fill out with our office. Part of the reason we have students fill out a form with our office is we ask for your interest rate. And we've had some students who've had interest rates in the 13% or 16%. And if we know that, we would make sure that students are aware that, say, a Grad Plus loan has a 9% interest rate, which would be better. So we like to share that information to make sure you're making the best choice for what you want. And when you're looking kind of over the 4 years, our most recent data is that students were graduating with about $181,000 in debt. We are still analyzing what the debt was for the class of 24, so we'll know that in another month or so. But our students on average are graduating about $15,000, almost $16,000 of debt less than other students nationwide at public schools. So our students are doing a great job of budgeting, kind of borrowing what they need. But one of the things that can contribute to kind of higher debt is if you have to take an extra semester or two to graduate. So I definitely recommend that students use resources available to you kind of earlier in your career. Use counseling and ed support. They have some study groups, or talk to your society director to make sure that you're studying kind of the right things and developing good habits so that you can graduate on time, get good grades, and match hopefully where you want. But that 181,000 of debt doesn't always tell the full story. Nationwide, about 28% of students enter the MD program on average with about $27,000 of undergrad or other graduate debt. And then sometimes students have credit card debt In some cases, students may borrow what's called a residency and relocation loan, maybe a loan after they finish the MD program to cover the cost of a rental van or something like that to help them move across the country for residency, and that may add an extra 10,000 of debt as well. But if you're looking at our amounts and you're saying, that cost of attendance is generous, but it doesn't quite cover everything I have that I need, some things that we will accept appeals on. Probably the most common is dependent care. So if you have infants, toddlers, preschoolers, we do surveys each year and determine what kind of the maximum amount you can get reimbursed depending on the age of the child or children. We allow up to 2 technology appeals over your MD career. So if you wanted to buy, say, a laptop early in your career and then wanted to buy a tablet once you start doing rotations, that would be fine. A laptop and a tablet are 2 different types of devices, but we would not allow you to purchase the same category. So if you buy a tablet early in your career, you can't buy another tablet later in the career. We provide money with those living expenses. Some of that is for car maintenance, and some of that are for kind of medical related expenses throughout the year. And let's say maybe those are in the ballpark of 800 per year. If you have a high car repair, maybe $2,000, $2,000 repair minus 800 and the cost of attendance, we could give you a $1,200 increase in the cost of attendance to receive additional loans. Same sort of thing works with medical expenses. If you were hospitalized or if you have high prescriptions, we could give you additional loans to cover the difference between what you're paying minus what's already in the cost of attendance. We do allow income appeals, but for med students, most of the aid is not based on financial need. And so we often ask students to tell us what they're seeking out of the appeal. So in some cases, maybe your student aid index is $1,000. You could do an appeal, but the difference between a student aid index of 1,000 versus 0 may not make much of a difference. The School of Medicine may still consider you to have lots of financial need for their scholarships. But if you reach out to us, we can look, and if it looks like it could benefit you, we can tell you how to go through that process. Finally, I'd like to talk about some things you can do to prepare yourself financially for the MD program. 2 of the bigger things are to get rid of expenses that we cannot help with. So if students have credit card debt, if they have car payments, those are 2 areas that the government does not allow us to do an budget adjustment to help with those. So if there's a way to work extra, to sell things, to just get those paid off, that would be really helpful. So that way the full $2,785 living expenses can go to you for all the rent and food and utilities that you need. If you have a high car payment or high credit card monthly payment, then that's coming out of your $2,785 per month for living expenses and making it harder for you to live off of. The last thing I would share is to kind of start working on a budget. It often takes 3 to 6 months to develop a final budget. It's easy to remember things like rent and utilities that maybe are a little more consistent, but it may take time to uncover things that happen irregularly, like car insurance, tags and taxes, maybe even gifts to family members. Maybe there are certain months that you have a whole bunch of gifts that you need to buy. And so if you give yourself 3, 6, maybe 9 months to uncover those, you can start setting aside a certain amount each month so that when those irregular expenses occur, that you have the money set aside to pay for those. Myself and my colleagues, there are five of us in our office, are happy to talk with you on the phone. So from 8:30 to 4:30, Monday through Thursday, we have people on the phone. If it's a question that's 15 minutes or less, give us a call. We're often available because many of our students are in class during that time, and so it's a great time to call. If it's going to be a longer conversation, shoot us an email. We can do an appointment over Zoom or Teams. And on Friday, we work remotely just to get all the paperwork done so that the aid's there for you all when you need it. But if Friday is the only day you can meet, reach out to us. We're happy to um, handle appointments on those days as well. So thank you for your attention. We look forward to continuing the conversation when the time is right for you. And thanks so much.